Hello, I'm Dr. Preety Aggarwal. I'm a gynecologist at Motherhood Hospital, Sector 57. Today we are going to discuss blocked fallopian tubes. Now, what exactly is a fallopian tube? So, fallopian tubes are delicate tubes which are there, which are attached to the uterus and which actually transport the egg. So, they pick up the egg and they're transporting it towards the uterus. And in this process, the sperm is going to travel through the tube and meet the egg, and that's where the fertilization can take place, and then this fertilized embryo is formed which can be pushed towards the uterus. So basically these tubes are very vital for reproduction. Now, what is a blocked tube and what are the commonest causes of blocked tubes? So the commonest causes of blocked tubes are basically infections. There can be tuberculosis, there can be some surgeries which have damaged the tube, there can be ectopic pregnancy, smoking can also be a cause for blocked tubes, endometriosis, and sometimes fibroids can cause blocked tubes. And a blockage of the tube, if we talk in terms of infertility, then 40% of the cases are due to a tubal factor, that means due to some problem in the tubes. Usually a blockage of the tubes will not present with any symptoms. Sometimes the patient can have some discharge, can have some heaviness of the lower abdomen, can have some cramps, but not, sometimes you don't come to know at all that there are blocked tubes. How can we actually make a diagnosis of blocked tubes? So one is we take a history from the patient if she's having a problem in conception or some features of infection. And then if she's trying for quite some time and she's unable to conceive, then we should do a test which is called as an HST or an SST. So an HST, a hysterosalpingogram, and otherwise a sonosalpingography. So in the first one, that's normally done between the 6th to the 10th day of the cycle, where we inject a dye via the vagina, into the uterus, and that is seen to flow out through the tubes, and that's how we come to know whether there is any blockage of the tubes or not. If we use an ultrasound to do the same, then we can visualize the uterus also, and that is called as a sonosalpingography. And there water is injected instead of a dye into the uterus, and we keep doing an ultrasound. So these are methods to diagnose blocked tubes. But once we diagnose a blocked tube, then what can we do to help the patient? So the next step then becomes laparoscopy. On a laparoscopy, we can actually check whether actually the tubes are blocked or not, and also try and correct any factors which are causing blockage of the tubes, and sometimes try and open the tubes also. So in the laparoscopy, we can actually inject the dye again under vision, and sometimes we are able to see that the tube may not be blocked. The patient is completely relaxed at that time under anesthesia and everything is fine. Or if there's some small adhesions and all that we see, they can be released. And sometimes we can do something called as a tubal cannulation and try and open the tube also at the same sitting. If there is any endometriosis, we can try and treat the endometriosis also. With this complete assessment, we can know whether the patient has chances of a natural conception or not. If we are able to open the tube and even one of the tubes is open, the patient has good chances of conceiving naturally. But if we see that both the tubes are blocked or the condition is not okay, then IVF is a good procedure for which we can go in, because the tubes are bypassed in the procedure of IVF and the patient can conceive through the IVF. If we see any hydrosalpinx, that means there is any fluid collection in the tube which is there, then in that case we have to treat it. And most of the times if we see a hydrosalpinx and we see the other tube is also damaged, then we should think in terms of IVF. And we should also help the patient by either removing the tube with hydrosalpinx or clipping it, because the fluid from a tube, which has hydrosalpinx can actually cause a problem in the IVF conception also. So if I really want to sum up, I would like to say that open tubes or tubes which are patent are very vital for reproduction to happen. Infection is the commonest cause of blocked tubes, and if the tubes are blocked, IVF is a thing. IVF is the technique which we can use for the patient to conceive, and one tube which is open can also result in a healthy pregnancy, and we should not really get worried but take next steps with a good gynecologist in case we find a report of blocked tubes. Thank you.